In the twilight years of life, many seniors believe they understand their bodies well. However, some conditions evolve quietly, subtly, without noticeable pain or symptoms, and one of the most underestimated is non-alcoholic fatty liver disease, NAFLD. This condition, increasingly prevalent among older adults, especially those who are overweight, doesn't make noise. There's no sharp pain or sudden fever. Instead, it progresses silently like a shadow on the wall. It's a pressing concern for senior health that often remains undiagnosed until serious complications arise. NAFLD occurs when fat builds up in the liver cells without alcohol being the cause. In older adults, this is often linked to lifestyle factors: poor diet, lack of exercise, and metabolic disorders such as type 2 diabetes or high cholesterol. While NAFLD was once considered a lifestyle disease, it's now a global health threat, particularly for seniors. With age, the body's ability to metabolize fats weakens. Seniors often experience reduced physical activity, slower metabolism, and hormonal changes that contribute to fat accumulation in the liver. At the same time, chronic conditions like diabetes, hypertension, and obesity, common in the elderly, create a perfect environment for NAFLD to develop. Additionally, aging affects immune function and liver regeneration. A young liver might cope with temporary fat accumulation, but an older liver struggles to recover. Many elderly individuals also take multiple medications, polypharmacy, which can burden the liver and exacerbate existing issues. In the early stages, NAFLD is often asymptomatic. Seniors may experience vague symptoms such as fatigue, discomfort in the upper right abdomen, or a general sense of sluggishness. These symptoms are easily mistaken for signs of aging or other minor ailments. As the disease progresses, more noticeable symptoms may appear. Persistent fatigue, unexplained weight loss, jaundice, yellowing of skin or eyes, swelling in the legs or abdomen, ascites, and confusion due to toxin buildup, hepatic encephalopathy. These signs often indicate severe liver damage such as non-alcoholic steatohepatitis, NASH, or cirrhosis. Obesity is one of the strongest risk factors for NAFLD. In seniors, excess body fat, especially visceral fat around the abdomen, increases the liver's fat load. This leads to insulin resistance, one of the key drivers of fatty liver. Visceral fat is not just an energy store, it's hormonally active, releasing cytokines and inflammatory substances that further damage liver cells. Seniors with central obesity are therefore at significantly higher risk of progression from NAFLD to NASH and cirrhosis. Detecting NAFLD in older adults involves a combination of clinical assessment and diagnostic tools. Routine blood tests often reveal elevated liver enzymes ALT and AST, though these can be normal in early stages. Ultrasound is commonly used to detect liver fat. More advanced imaging like fibroscan or MRI elastography provides detailed information about liver stiffness and fibrosis. In some cases, a liver biopsy may be necessary to confirm the diagnosis and stage of liver damage. Non-alcoholic steatohepatitis, NASH, is an advanced form of fatty liver disease involving inflammation and liver cell damage. In seniors, NASH poses a serious threat as it can quickly progress to fibrosis, cirrhosis, and liver cancer. NASH is particularly dangerous because it remains silent for years. By the time symptoms appear, significant liver damage may have occurred. Elderly individuals with diabetes, hypertension, or metabolic syndrome should be regularly screened for NASH. Beyond physical symptoms, NAFLD and NASH affect seniors' emotional and psychological well-being. A diagnosis of chronic liver disease can lead to fear, anxiety, or depression. The idea of long-term treatment or potential complications like liver failure or cancer weighs heavily on patients. Seniors may also face social isolation due to physical limitations or dietary restrictions. Therefore, emotional support and mental health care should be integral to fatty liver management in older adults. A liver-friendly diet is crucial in managing NAFLD. Seniors should focus on a Mediterranean-style diet rich in vegetables, fruits, whole grains, lean proteins, especially fish and legumes, and healthy fats like olive oil and nuts. Processed foods, added sugars, red meats, and saturated fats should be limited. Small, frequent meals help digestion, and hydration supports liver detoxification. Vitamins E and D, omega-3 fatty acids, and fiber-rich foods may also offer protective benefits for the liver. Regular physical activity helps burn excess fat, improves insulin sensitivity, and supports overall health. For seniors with fatty liver, safe and consistent exercise is a powerful tool. Options include walking, yoga, tai chi, or light strength training with resistance bands. Aim for at least 150 minutes of moderate activity per week. Even gentle movement boosts liver function, improves circulation, and enhances mood. While there is no FDA-approved drug specifically for NAFLD, several medications help manage associated conditions. These include metformin for insulin resistance, statins for cholesterol, and vitamin E for inflammation. Advanced options include experimental drugs targeting fat metabolism and liver fibrosis. Lifestyle modification remains the cornerstone, supported by medication when necessary. Seniors should be closely monitored for drug interactions and side effects. Untreated NAFLD can lead to NASH, cirrhosis, liver failure, or even liver cancer. Seniors with untreated fatty liver may also face increased risks of cardiovascular disease, kidney problems, and diabetes complications. Cognitive decline and frailty are also linked to chronic inflammation and metabolic imbalance. Prevention and early management are critical to avoiding these dangerous outcomes. Prevention is the best treatment. Seniors should maintain a healthy weight, eat a balanced diet, exercise regularly, avoid alcohol, and manage chronic conditions. Routine liver screenings, stress reduction, and proper medication use are key. By taking proactive steps, older adults can protect their liver and enjoy a vibrant, healthy life well into their golden years.